Good morning. I am going to be inserting a indwelling Foley catheter this morning. I came into the room and I've washed my hands. I've identified my patient by asking them their name and date of birth. I've explained the procedure as to what we're going to do. My patient has had surgery and is having some issues with urinating. I've come to open up my kit. It was enclosed with a bag, and the bag I will be using for my garbage. You always want to open up your sterile package away from you. Inside of my package is a set of sterile gloves, which I will lay to the side, and then we have my sterile drape, and I want to pick up my sterile drape by the corners, and I'm going to fold it with the shiny side out and go back towards my patient. Okay, my sterile field is now set up. I'm going to apply my sterile gloves. Okay. I have my sterile kit here. I start out by opening up my povidone iodine swabs, and I'm going to just pull them out and lay them in my tray and put that in the garbage. And I always want to make sure I'm remembering to keep my hands above my waist because I'm in a sterile field. I'm also going to open up my lubricant and put that onto my tray. Then I'm going to take the top of my box and set it aside and find my catheter, and I want to check to make sure that my balloon for my catheter is working. So I'm going to put a little bit of water in to make sure that my balloon inflates, and it does. There's no leaking, there's nothing there. So then originally there would be a wrapping over the catheter, which I had removed previously because my first video didn't work. So I've removed my plastic, making sure to keep my catheter from getting contaminated at all. I'm then going to lay this back in my box. I'm then going to contaminate my left hand by spreading the labia and looking for the urinary meatus. I'm then going to come with my povidone swab, and I'm going to do my farthest side away first, come back around, throw that, do my inside of the labia closest to me, throw that, and then go down the middle over that urinary meatus. I then want to take my catheter, and I'm going to make, whoops, I shouldn't have let go of my left hand. Normally I wouldn't have done that. Okay, so I'm going to always leave my left hand. I'm going to take my right hand and I'm going to start inserting the Foley catheter. I want to go 2 to 3 inches until I see urine start to flow. Once I see urine start to flow, I'm going to insert the Foley catheter 1 more inch. Once I have the catheter in, I'm going to take my left hand and pinch about an inch away from the urinary meatus and proceed to fill my balloon with water. As I'm doing this, I'm going to be asking my patient if they're experiencing any pain or noticing any grimacing while I'm doing this. If they are, I would probably move the catheter a little bit because I may not have it in the correct spot. I want to make sure I keep pressure on my syringe. I'm then going to let go, come back. I would pull just a little bit to make sure that it's in the correct position. I would come back, stabilize, and remove my syringe. I would then attach my catheter at the Y to my patient's thigh, leaving a little bit of room so that it's not pulling or tugging for them. I would then go and get rid of my garbage. Remove my gloves and put on a clean pair of gloves. I have my container for my specimen later on, and then I'm going to dump this onto the bed and get rid of that. I would then take my bag and I would attach this to a non-moving part of the bed so that the urine can flow freely, and I would take the rest of the tubing and coil it onto the bed so that everything is free moving. And this concludes my insertion of a Foley indwelling catheter.